Good morning. Good to see you all here on a rainy day and sharing in the really exciting news about the advancements in treatment of melanoma. I have the great pleasure of leading the Survivorship Program at Stanford, and thank Susan Sweater and Sam Guild for not only inviting me to share some of our early learning about the needs of melanoma survivors at Stanford, but for putting survivorship on the agenda today. The definition of a cancer survivor is highly personal. The definition that works for many is from the day of diagnosis, and that's reflected on basically what we used to call the lay literature, but now it's the internet. Using that definition, there's nearly 1 million melanoma survivors in the United States, so from the day of diagnosis to the last day of life. And while each of you probably know what the psychosocial and physical needs are, as a medical community, we have not studied that very much, and they are not well understood by us. So 2 years ago, in 2012, we conducted a clinical survey just to determine if survivorship needs of patient or people treated for melanoma at Stanford were being met or not. We invited anyone whose name we had that was treated for melanoma at Stanford, and for any of you in the audience that participated, we thank you. 160 people responded, and it was an internet survey, so we know that we lost some people just in the way we had the survey set up. What was interesting is of those that participated, they were on average 5 years from diagnosis. They were about half men, half women, in their 60s, Caucasian, and highly educated. When we looked at the type of treatment each of the respondents had, about 3/4 had surgical excision plus something else. Usually it was a sentinel lymph node biopsy that you heard about earlier this morning, but it could also have included chemotherapy, immunotherapy, or other things. And about 1/4 actually just had their melanoma surgically removed. What we found when we compared the two groups is that those that had more treatment had more symptoms, more long-term symptoms. And fatigue, which is just a persistent tiredness, weight loss. Women more than men had limb swelling, and either sex could have felt weakness. What we found really interesting is, and remember, these are people who were at least 5 years from diagnosis, that 40% of the people that just had surgical removal wanted more information on how to protect their skin moving forward. And if you want any more information about this, we actually published the article in May of this year. So for all respondents, these are the symptoms, what we're calling survivor symptoms, that they experienced. 33% experiencing anxiety. And again, what was different about this compared to other people who have lived with cancer is that typically women will report anxiety more commonly than men. And in our survey, it was equal across the sexes. People had numbness, and we did not look to see or ask if this was numbness just at the surgical site or in other places. What was surprising to us is the number of people that reported forgetfulness, changes in their sleep or their mood, pain, and again, change of energy in the form of fatigue. 53%, or just over half of all respondents, said they had an educational need. 1, for long-term effects. 2, for what their family risk was and how to protect them. And 3 is how to prevent future damage of their own skin. So we also learned that the discussion of these symptoms is not routine, that as providers, we're not bringing it up at least 70% of the time. And when these symptoms are discussed in at least a clinic visit, that this person who was treated for the melanoma was initiating the conversation the majority of the time. With that, the request for treatment has been limited. Only 20% of the respondents asked for treatment of these effects, and 12% said they wanted emotional support. So in conclusion, what we learned from this very preliminary survey is that there is a need for particularly for more information about long-term effects of melanoma and its treatment, of psychosocial support from the day of diagnosis, and prevention of further skin cancer. So what can we do about it? You heard so much today, not only about where screening recommendations are and where they're going to go in the future, but also what the treatments are. The question is, what kind of action or thought is within the control of each of us today? And one is, in terms of preventing skin cancer, is to avoid tanning beds and to avoid the activity of tanning itself. And while this is not new to you, it's a reminder that you want to protect yourself and seek shade between 10 a.m. and 4 p.m. And cover up with clothing, and that isn't only the clothes we have on today and a chilly day, but also the hats, like I see so many of you have on your laps, where there's a 4-inch brim. And for you and your family members, that we're getting better at being able to figure out which sunscreens are more effective than others. With the help of the Skin Cancer Foundation, the American Academy of Dermatology, and dermatologists like Dr. Sweater, we have been able to have the products list their specific screens more effectively. The last is to know your skin and to be doing the head-to-toe examinations in a full-length mirror about once a month. And then, just as you heard earlier today, to have a healthcare provider examining your skin as well. I'm a mother of 4 children. They're all teenagers. I have very fair skin. And one of the things that I think is most exciting about the work that's being done at Stanford are small programs like Sunsport. This is being run through a small group that is partnered with Stanford Athletics. And in my mind, it has 2 goals. One is to help the athletes protect their own skin and to convince the coaches that this is important. What I hope will be the long-term implication is that for children and parents who look to those athletes as role models, that they will follow suit and that they will protect their skin, and coaches will be mindful of things like not holding practice between 10 a.m. and 4 p.m. In terms of thought and action, there are some things that we can offer you as resources today. And one is in terms of thought. Living with uncertainty is very difficult. And one of the strategies that can be used is mindful meditation. And what I mean by that is having that quiet place, that quiet body posture, and that mantra to be able to just observe where you are in the moment. Not where you've been, not about the past, and not about what the future can bring. And that kind of training is available to you for free on a drop-in basis every Tuesday at 4:30. There's other types of relaxation strategies that are taught and are used by many people. Some of it is prayer. Some of it is guided imagery. And for those of us that need to run, it's in the form of exercise. Other action methods are expressive writing. There's a class that's available to you every Wednesday of the first Wednesday of the month. There's art therapy, and there's other forms of expression that can be very helpful in dealing with the challenges, the symptoms, and the thoughts that follow a diagnosis of melanoma. Stanford is continuing to develop a survivorship program. It is in the form of transition to survivorship visits. I'm happy to see any of you in a clinic visit to help you not only know who to call for what, but to talk about these symptoms and methods of caring for yourself in a more detailed way. For those of you that like education and support in a more remote fashion, we have a growing collection of survivorship lectures that are all videotaped and on YouTube, and you can find them at this address. Or you can just Google Stanford Supportive Care, and they'll come up. Every symptom that I listed from our survey is addressed in a lecture. And there's a great collection of videotape lectures now for caregivers. We know that cancer doesn't touch just the person that was diagnosed. We know it's a family event, and that the caregivers in particular carry a heavy burden, and that we haven't been as supportive of those people as we need to be. My email address is here. Feel free to contact me about anything. And then to end with partnership. So we are so grateful to AIM at Melanoma for helping us host this conference this morning. And they actually have partnered with us in other events like Living Well with and Beyond Cancer. This was a first-time event last August. We had about 800 people attend, including organizations like AIM at Melanoma. It's to honor all of you, everyone touched by cancer. We'll hold it again August 22nd, 2015. You're all invited, and I hope you'll come. And it's a time to celebrate, and it's a time to learn from each other, to hear about what's new, to hear about what other people are learning, and to just be grateful that we are moving forward to live a good, long life. And so I look forward to your questions and to the other thoughts that will come out from the patient panel.